starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's going to do, it's going to stop the hair from falling out that you already had with the surgery. Plus, it's going to help other hair come in thicker and more fuller, like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
Isn't that fabulous? You know, the first time I heard Martino tell us a story, and that is, of course, our Martino Cartier, who we love, love, love here at HSN, I was like, you've got to be kidding me. And by the way, this is way before we offered Capillus here at HSN. So let me share with you what is going to happen right now. This has become, honestly, for me, and I know I said this the other day, one of my personal favorite products, because if you are out there, you know, I will speak primarily about women. It is for men and women, but if you, we all know our hair ages as we age. So if you are noticing that your hair is falling out and you can't do anything about it and you're wearing hats and you're embarrassed, you have come to the right place, because what would you say if I told you you can make one purchase today and purchase an item that is not only FDA cleared, but will literally regrow your hair in as little as 6 minutes a day. Exactly. Look at this before and look at these afters. And one thing that you notice is the fullness of the hair, and and honestly, as we said before, if it's maybe in certain areas, maybe you're just balding around the crap, maybe it's around the crown area, or maybe it's the front. Look at the difference in his hair after 6 months. Unbelievable difference. Well, we have a lot of before and afters we're going to share with you. This one I really wanted to see, because this is something that I know right now so many women out there can relate to. You know, all of a sudden you notice the part keeps separating and separating and separating. No more. Today, thanks to Capillus, we have literally the lowest price absolutely anywhere for this incredible cap that is a laser cap, by the way, which you're going to notice something very different about it. This is not just a line of like 1 or 2 lights underneath. There are 202 laser lights, so you are getting full coverage, a true medical grade professional device that will change. Because guess what? It will literally grow your hair. FlexPay as well. My pleasure to welcome Barry Pinter, who is without a doubt been in not only the hair care industry for over 30 years. You are a true hair loss expert. You have lived this yourself to share the story. This is an amazing, amazing product that we've heard phenomenal results from people.
And I get so passionate about this, as we talked beforehand. Yeah. I said, Bobby, sometimes you have to talk me down because I'm so passionate about this. But here's why. I know so many of you, like me, I mean, you just take one quick look and you can tell that I started losing my hair quite early, way in my 30s. And the reason that I get so passionate about this technology is there are so many things out there that you have tried, that you have put your stock in hoping it would work, and it just didn't work. And does it make me angry? Yes, it makes me personally angry, because I was one of them. So what you want, I completely understand, is someone just to tell you, what can you do? Can I really stop my hair from falling out? And can I really help to regrow my hair in any way? Well, I am happy to tell you, we're gonna talk about that in these next few moments, because, Bobby, I've sat with thousands of men and women over my career, and it was my job to explain to them what can happen. And you're seeing on your screen right now exactly what can happen. What's happening is your follicle is dying. It's called miniaturization. It's gonna get smaller and smaller and smaller until it is finally gone. That is permanent baldness. The medical community has discovered, because we are talking about a medical device here, that if we use a very specific color spectrum of laser, we can actually reach that follicle that is on its way out, stimulate the cells in that follicle, and do what's called in the medical community reverse miniaturization. So now, while it's getting smaller and smaller and smaller and dying, we are actually making it bigger and bigger and bigger and healthier. Look right here. We can see in the before and afters. This is Lester after 3 months.
And we have 6 months.
You have 6 months.
6-month return policy.
For good reason. If we can cycle back to Daniel, I'll show you why. And we'll go before, we're going to actually talk about what you could expect. So that's Daniel, 6 months. So look, so someone like Daniel would typically come into my office and just say, please help me stop my hair from falling out. That's all he wanted to do. Or any male or female. That's why they typically came to see me. I was able to tell them we can not only stop your hair from falling out, we can actually regrow your hair. Yvonne, very typical female patient of mine. Now, the loss may be more than that, but whichever, Yvonne would come in usually in one of two ways: a complete panic, talking a mile a minute, or with tears in her eyes holding a tissue. And I'm not trying to be dramatic, but this is huge to them. They want someone just to give them a straight answer. And I would say, Yvonne, guess what? We can not only stop your hair from falling out, we can actually help to regrow your hair with, listen to this, an FDA cleared, and listen to this, medical device, and listen to this, a biomedical technology that is professional strength. So you all may have seen in the past, you may say, wait, I saw a laser product and it was like $400. This is $1,699. Well, why? Because those ones you saw that were $400 may have been 8 lasers. Then there are things that are 40
little strip of lasers.
Exactly. This is the actual 202 laser professional grade dosage that your doctor would provide to you if he or she wanted you to begin
Absolutely. And by the way, it comes with a happy. You can take it out and you can put it in any hat. Here's the thing. We have sold hundreds of these over the last couple of days. It is a one-time purchase. And one of the things that I think is so important about this as well, think about this as preventative. Because Barry's going to talk about the fact that for women in particular, we do not have a lot of options. This is the effective option. And because we believe so strongly, I will speak for myself, I believe so strongly in this. I know this can give you back your hair, can regrow your hair. I'm giving you a 6-month. You have a 6-month return policy. And then you have the ultimate confidence because you are buying an item, again, that is FDA cleared. This is not a cosmetic solution. This is a medical solution. And I know that we also have a very special doctor, Dr. Dines, that we would love to share with you because Dr. Dines is someone that a lot of us know. And I think it's so important because we want you to know. We want you to have that consumer confidence, but I'm here to share with you. There is nothing like this. We have the lowest price absolutely everywhere. You have not a 30-day return policy. You have a 6-month return policy. So we just want you just get it home and 6 minutes a day. Think about that. 6 minutes a day. So you put it on your head and you can be there. You can be doing your laundry. You can be checking your email. 6 minutes a day. We all have 6 minutes a day. And I know you have 6 minutes a day to be able to regrow your hair. Here she is, Dr. Dines.
My name is Dr. Adrienne Dines. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
You know, I love this because that is like really confidence. And let's talk about what does it mean to have an FDA clearance?
Exactly, and that's why this is so important to the medical community because you just heard Dr. Dines said one of the things she loved with this was FDA cleared. You heard Martino say his doctor recommended this to him because it was FDA cleared. So what does FDA cleared mean? And I explain that because it'll give you a lot of confidence. In order to get an FDA clearance, the FDA has to be satisfied of 2 particular things. One is called efficacy, meaning this product, this light that you're seeing, this red laser light, will actually stop hair loss and help to regrow hair. If it did not do that, it would not get an FDA clearance. It's what's called efficacy. This will do what it says it will do. But number 2, and equally, the FDA has to be satisfied through these human clinical trials that it will do what it says it will do safely. So think about that. You don't really have to take Barry's word for it, or Bobby's, or Dr. Dines's, or Martino's doctors, or the library of doctors that we have at our corporate headquarters right here in the USA on record as saying this. You can rest assured in the fact that the FDA clearance on this technology means that it is, number 1, effective, and number one safe. And Bobby, that's huge.
That is huge. So two things I want to ask you.
Yes.
First of all, I think it's really important initially if we can address options as women, because as women, you know, men have a lot more options, right? I know my brother-in-law who goes out and spends a ton of money for his hair and has to constantly keep spending more and more money.
Yeah.
But for women, what are our choices?
Okay, so for women, there are only 3 choices. And again, this is something huge I hit when I meet with folks in the office. Number 1 is a topical. And I'm champions of all of them. I'm not gonna talk bad about all of them because these are actual things the medical community recognizes that you can do to help stop hair loss and help cause hair regrowth.
Got it.
And because the medical community recognizes, I love them. Number 1 is a topical, okay? You put it on and leave it on twice a day for it to work. It's called many things over the years. It's repackaged many ways, but it works. The other one is a visit to the doctor's office for the rest of your life for injections into your scalp. Costly, painful, yes, all of that. Again, I'm not going to talk bad about it. The medical community recognizes it, but it is the most challenging of them all because you constantly go to the doctor's office, okay? Then there's the third one. Remember what I said, there are only 3, so all that other stuff out there, it's just noise that you've been putting your money into that isn't real. A topical you put on twice a day. Visit your doctor's office, or what's known as low-level laser therapy. In this case, you push one button, you put it on your head, and the treatment begins. 6 minutes a day. So not twice a day topical, not doctor's office visits, 6 minutes a day, you push the button, you put it on your head, you leave it there, and I am now getting a laser treatment right now. 6 minutes later, this will automatically turn itself off. I take it off, I put it back in the drawer, repeat next day. It's as simple as that. But that's when it's important, ladies. 3 things, okay? Because I hit that, Bobby, so hard. Because we're so filled with this noise of stand on your head, run faster. I mean, it's crazy.
It's all
Take
nonsense.
this pill, do this. Topical, doctor's office visit, LLT, bam. This one, the professional grade treatment, 202 lasers, the same one that you would get from your doctor.
And the lowest price anywhere. And then here's the other thing. I remember the first time I asked Barry about this, I'm thinking, okay, what about preventative? You know, particularly if I have someone in the family that might be predisposed to losing hair.
Absolutely.
I think it's a great idea to make that investment because it is an investment. Like, I mean, if I have it, I can use it. My husband can use it, correct?
Investment, yes. But remember, there are 3 things that you have to continually pay for the rest of your life. This is, you buy it once. So when you do, when you add it up, at the end of, no, seriously. You know, well, actually, one visit to the doctor's office for 2 months is what this will cost you for a lifetime.
Exactly. So let's walk through, you know, for a lot of women going, okay, is this for me? Who can use this?
All right. So this is what's called the Ludwig or the Savin scale chart, okay? This is a typical androgenic alopecia pattern baldness. Excuse me for using these big words, but chances are, if you're suffering from this, you've heard them from your dermatologist or from your doctor, okay? Typically, the part's getting wider and wider and wider. That is a typical classic female pattern baldness, all right? You saw that before, our before and after, which we'll take a look at in a few minutes down the road, but that's what it is, okay? If you're in the blue, you're good to go. In the white, it's not that you shouldn't get this. I'm not going to say that because I'm going to explain after these charts exactly who this will work for and who it won't work for, but you are going to stop the hair loss and you're going to help to regrow hair. Okay, this is called the Norwood scale in the men's chart the medical community uses. You can see if you're in the white on the top, the 1 and the 2, you're good to go. You have a good head of hair. Starting at 2, 3, 4, 5, you can see it's time to really address this because the clock is ticking. Baldness is progressive. We all know that. It just gets worse. It never gets better. Short of one of these 3 medical solutions where you're going to address it for yourself.
And you know what? As a woman, I just speak for women. You know, we always say, like, our hair is our crown and glory, right? So if you're noticing all of a sudden you're brushing your hair and more hair is falling out, or if your part, as I said, is getting wider or it's getting, you know, balder around the crown or around the side, listen, this is one purchase. And I know it's expensive, but let me just tell you, it is not versus everything else and all the money that you would spend and the fact that we believe so strongly that we are giving you not a 30-day, but you have a 6-month return policy. And then the thing that I love the most about it, beside the fact that it's FDA cleared, so I have that confidence from the medical community, but the fact that It's 6 minutes. It's only 6 minutes a day. And by the way, it's really comfortable. It's light. You can even take the whole laser unit out. And like some of the units that are out there that are just, I saw one the other day, it was like just a little strip. What good is that? This is 202 lasers. So this will cover your entire head. I mean, you don't even realize you're doing it. So whether you are buying it because you're already experiencing, or from me, and Sonia and I had this conversation last week too, whether it's just perhaps preventative. Know that at HSN, the reason we have sold, actually, even over the last few days, hundreds of these. A lot of people, maybe you've seen it, maybe you've been thinking about it, maybe you've done your comparison shopping. I welcome you to do that. But I also encourage you, and FlexPay, that you can get this home for $283 with, and again, that is a 30-day, oh, wait a minute, no, it's not a 30-day return, a 6-month return policy. And Barry, for any of the women out there, and obviously this is for both men and women, but the wonderful thing about this, I know we even have a great 5-star review at hsn.com. This is not something new. I mean, this is a product that has been out there, that has been proven.
And that's important to notice, because I don't want folks to think that they're taking a shot at something.
Yes.
This is actually, this technology has been used, was discovered in the 60s. And has been used for years in hospitals to help burn victims heal more quickly, help wound victims heal more quickly. It's been within the last decade, a little longer, that the medical community has realized this does amazing things for hair. So who is this for?